What up? It's Kyle. As you might know, I'm on a new journey to try and hit a 45-inch vertical as a 35-year-old dad and business owner. So I'm trying a new program where it is a very minimalist training program, training 2 days per week, one upper day, which is what you're going to see in this video, and then one lower day, as well as one like speed, plyo, vertical jump focused specific day. In addition to that, I'm also doing 10 to 15 minutes of daily mobility every single day. And I'm going to try and squeeze in some home workouts, like just for arms or, cardio, easy cardio, things of that nature, whenever I can get them. So this is the upper body workout. We're starting with med ball throws, which is one of my favorite ways to mobilize the rib cage, wake up your nervous system, like really feel awake and ready and kind of like ready to attack the training session, if you will. I always like to do something athletic. If it's an upper body day, throwing medicine balls is a great way to do that. If it's a lower body day, jumping and sprinting, something along those lines, just to, again, prime the nervous system to get ready for a high quality, high intensity training session. Then we moved on to these side plank bridges. I believe I did 2 sets of 6 reps, and then I'm holding a 25-pound dumbbell on the top of my hips. This is really good to open up the lateral rib cage, and mobilizing the spine is actually one of the best things that you can do prior to an upper body day, because your shoulders are attached to your shoulder blades, which are attached or, right next to your rib cage. And so the better you move kind of like from the inside out, in terms of joints, the easier upper body lifts tend to go in terms of shoulder mobility and comfort. After we did the side plank bridges, I'm moving over here to a split stance row, cable row, where the cable is anchored height-wise about where my belly button is. So it's a slightly upward pull, but I'm trying to keep it as horizontal as possible. The goal with this exercise is to try and keep all of your weight over your front foot, shift a little bit into that front hip. So I'm shifting and turning a little bit into my left hip and holding on to that position. And then you're going to row and reach with the opposite hand. So cable always in the opposite hand as the leg that's forward. And you're kind of doing this, I guess, bow and arrow action, where as you pull your hand back and row, the other hand is going to reach forward towards the anchor point. This is really good for getting the rib cage to rotate. So any sports that involve rotation, golfing, throwing, things of that nature, or just to have the ability to rotate is very, very important for overall athleticism. So we're doing nice and controlled reps here. Again, holding on to weight pressure in the front foot and a slight shift into the front hip. Next, we're going to move on to this landmine, medial delt raise. You're going to start by positioning the end of the landmine, or the end of the barbell should be right in front of the outside hip. So barbell is in my right hand. It's going to start at the bottom right in front of my left hip, and I'm going to raise it up and out to the side like a Y, just following the natural arc of the bar. And if you do this correctly, you should feel your shoulder blade, especially on the up, move down. So kind of like doing what's called a posterior tilt. So bottom part of the shoulder blade moving down to the ground or down towards your butt. And that's really going to light up your low trap. So this is good for like posterior delt, back delt. It'll get some medial delt as well. So the middle part of your shoulder on the side, and then also muscles around the shoulder blade. Big low trap exercise. Low traps are often hard to get, and so this one does a good job of kind of hitting the whole shoulder, but specifically that lower trap. This one's really hard, so most likely I'm going to have to progress these very slowly. I'm thinking about half a pound a week, and I do that with fractional plates, which you can get on Amazon. It's like a quarter pound, half a pound, 3/4 of a pound, and then 1 pound. You get a set of 2 for each of those, so it's 5 total pounds, or 2.5 on each side. And they're really, really good to help you make, again, slow incremental changes with your lifting, which is very easy to recover from. So it's very practical for busy people. And also, it's nice to get that essentially the dopamine hit of always making progress every single time you go into the gym. Next, we're going to move on to tall kneeling landmine shoulder presses. I actually prefer to do this in short seated, where you're kind of like either sitting on a medicine ball or sitting on a low box. But for convenience sake, I'm doing these in tall kneeling because it's just a lot easier than having to move a medicine ball or a low bench, especially if you're in a commercial gym. The main thing with these is you want to keep your ribs down. So you can see that my right hand is on my rib cage right here. I'm thinking about pushing my left hand up and away and pushing my right hand back. So you want to try and keep your rib cage back as much as possible as you are pressing upwards. Here I demonstrate where that doesn't happen, where the spine extends and the ribs go really far forward. That's what a lot of people end up defaulting to when they do their shoulder presses, especially as they start to get tired. So keep those ribs back. Next, we move on to bench press. I do a set of 5 and then follow that up with one set of 8. Big thing here is very anti-arch the spine as much as possible in order to shorten the bar path. I mean, that's fine if you're a competitive power lifter, but just from a shoulder mechanics and health standpoint, I like to keep a more neutral rib cage position, and I achieve that by putting my feet on the bench, flattening my lower back down into the ground, and just thinking about my upper back staying heavy into the bench as my hands push away from my body. As you can see, 8th rep was a bit of a grinder, so in terms of like finding the appropriate load, I know that I'm pretty much in the sweet spot. Next, we have pull-up isometrics, 2 sets of 30 seconds. I think I have I have a 3-pound weight in between my thighs, so kind of how you would hold it for like dips. And then I have, I believe, half a pound, small fractional plate in my pocket, and so it should be around like 3.5 to 4 pounds. I'm holding for 30 seconds, getting off, getting a nice, at least 60-second rest break. Probably more in the realm of like 90 seconds, because holding a 30-second ISO at the top of a pull-up is pretty challenging. So you want to make sure that you're fully rested so that your second set, you can still execute at a high level. Big thing here is you want to make sure that you're breathing throughout. It's very easy to, when your body is in a high stress situation, especially physically, just stop breathing. And so you want to try and avoid that as much as possible. I like cueing a breath in through the nose and a long, slow exhale out through the mouth. Next, we're moving on to weighted dips. I'm doing these as a cluster set, so you'll kind of see what that means, but 5 sets of 3. I have a 5-pound weight in my hands, and relative to my bench press, I probably should be using more weight for these dips. So after 3 reps, fast forward 30 seconds, and then get back into it. That's kind of the definition of a cluster set, where you do, 3 reps or however many reps it is, usually 5 or less, and then you're going to take some time in between, catch your breath, allow the muscles to semi-recover, and then get back into it again so that you can accumulate the volume that your program is after. But as I mentioned, I should probably use more than this. I know that I can from a strength standpoint, but this is me trying to put weights on because I'm a genius and I use a movable surface to do dips. We don't have a dip bar at this gym, so I have to kind of make do with what I got, but putting on the weights definitely helped to prevent my hands from moving all over the place as I'm trying to do dips. So again, getting back to what I was saying, a lot of people have, and I've experienced, anterior or front shoulder pain when doing dips. It's generally due to a lack of mobility of like shoulder extension, so the arm being able to go back behind you. That's the reason why I'm starting very light with these. I want to make sure that I can do full range of motion dips with no pain, with really good control, and not only pain during the session, but I'm also monitoring the next day. By taking a very slow and progressive and patient approach to dips, I haven't had any problems, which has been nice, but I think the overall principle to take from that is if there's something unique about your body in terms of pain or discomfort, listen to it and respond appropriately when you're trying to perform exercises or go about a workout program. Lastly, I have short seated. So this is that same position that I like doing the landmine shoulder presses in, just for reference. But we're going to do short seated lat pull downs. You can also do this on a lat pull down machine, but since we don't have one, we're going to use a cable at the top position. These are one set of 12 going to failure. So these were pretty challenging. I think I did this with like 155 pounds. And I'm just using my left hand. You can't see it, but you'll be able to see it when I switch hands. I'm using my left hand to push down into the ground just to provide some stability for the rest of my body as I row. I'm thinking elbow down and back behind, and trying to also coordinate my shoulder blade. So when the hand goes up, shoulder blade should round and come around the side of your body, or like side of the rib cage. And then as you pull the elbow down, you're also thinking about pulling your shoulder blade down and back. That way you use your scapular muscles, your back muscles, and also your bicep. As you can see, as it gets closer to the end of the set, it starts to become very difficult. That's good, because with a microloading approach where you're not training as frequently throughout the week, you need to make up for that in terms of your intensity. So it's very important that if you're not going to train often, that you train with a high level of intensity. Hope you guys like this video, and I will make another one for the lower body.